Welcome to Sum of Your Parts podcast. I'm your host, Dr. Betsy Greenleaf, premier pelvic health expert and women's wellness warrior. We'll be discussing women's health topics and how you're greater than the sum of your parts.
On today's episode, Dr. Elizabeth Cheravaty will be joining us. She's a naturopathic physician and feminine leadership mentor. She's the creator of the Well-Conceived Fertility Method, an evidence-based program helping women and couples to enhance their fertility, empower their journey, and enrich the health of their future children. She's also the founder of FemPowered Global, a community that inspires women to embrace their feminine power and create their own definitions of having it all. Dr. Liz is a graduate of the University of Guelph and the Canadian College of Naturopathic Medicine. She is an advocate for the potential of naturopathic and integrative perinatal care through what she calls the 5 trimesters, which we will be discussing here today. From preconception, pregnancy, and postpartum to powerfully influence children's and families' future health and well-being. Dr. Liz is the founder of Two Rivers Health, an award-winning integrative fertility and family care clinic in the heart of Guelph, Ontario, also serving clients through telemedicine, education, and coaching. I'm excited to announce that her first book, The IVF Meal Plan, was released in December of 2019. Information on her program and her book can be found in the show notes and also on my website at drbetsygreenleaf.com. And without further ado, I'd like to welcome with us today Dr. Elizabeth Cheravaty.
Thank you, Liz, for joining us.
Hi, thank you for having me, Dr. Betsy.
So we're going to talk about fertility and infertility. The interesting thing, I think back about when I was trying to have kids, and I think the funny thing was my whole life, I was going out of my way trying not to have children. And then all of a sudden you get to the point where you're like, okay, we're ready to have kids. And I go off my pill and I expected it to happen right away because, that's what's happened when you're trying to prevent it. So all of a sudden it's, you go off and now it becomes a chore. Now it becomes like, okay, why is this not happening? Like, I'm off my birth control. It should happen in the blink of an eye.
Yes.
So talk to me a little bit about fertility and infertility.
Yeah, absolutely. Well, I think your experience is very shared, very much shared across the planet. So many women do come off the pill and they're able to conceive right away, or couples are able to conceive almost right away. And others take more time, and others might even have some consequences from the pill that can impact fertility. But certainly we have what's been called in the literature a growing emergency when it comes to fertility rates, because fertility rates have dropped, particularly in the last half century or so, where now 1 in 6 couples globally who currently want to have a baby are unable to have one or are struggling to have one. And that is clearly not normal. And when you think about that experience of like doing our best to not get pregnant for a couple of decades because it's so easy and it's so automatic and you can blink and get pregnant. We have this experience as a species that it can be so easy, and this level of consciousness that we have to consciously not get pregnant, right, until we're ready, and we have to work hard not to. And so, yes, it should be easy. Yes, it should be the most natural thing in the world to conceive and have a healthy child. That's how we all got here. That's how every species all got here. And the world, though, has changed in the past century, especially since the Industrial Revolution and since 85,000 at least man-made synthetic chemicals have been invented and released into the world, and they find their way into food, air, water. They find their way into our tissues. We have changed the way that we eat. We don't eat the same way that our ancestors did, and that our genetic code really craves for and expects. So we're often overnourished with calories, but undernourished with nutrients. like vitamins, minerals, antioxidants, omega-3s. So there's that, and then there's unprecedented levels of psychological stress. And of course, we go back to the sort of societal norms now, where women and men are taking longer to become educated, to establish careers, to establish homes, and maybe even to establish the right partnership before starting families. And this means that all of these factors combined are really a part of the whole picture of why we might be having the fertility challenges that we are as a global community.
And it's so and then it becomes even more stressful. So you're already under stress, and that's affecting the fertility. And now you're taking something that's supposed to be so easy and supposed to be automatic, and now it doesn't happen. And that period comes, and it's like, oh, it didn't happen. Yeah. Now that level of stress goes up even higher.
Yes.
So it becomes very difficult.
It does. It can be absolutely devastating month after month, period after period. It can be very disheartening, and it can really affect people's self-worth. It is a very deep issue. Infertility is one of the most stressful life experiences that a person can have. It's been studied and found to be as stressful as having a diagnosis of cancer or chronic pain. And yet it's very isolating because there's a social stigma around it. So people with fertility challenges often don't talk about it. They don't often have friends in their close circle who, even if they're comfortable talking about it with them, who've shared similar experiences. So people often feel inherently flawed, and it's extremely disheartening. But that isn't true. They're not inherently flawed. The world is different. And I think we need to be taking a much more holistic approach to fertility, because it is about health, and it's not just about pathology or like something wrong.
What are the things that women can do if they're planning on trying to get pregnant, or even if they're in a situation where they're having difficulty getting pregnant?
Well, I think the first thing to do is to have a comprehensive assessment. That feels vulnerable in and of itself, because you're going in with this thing that's very personal, and you feel vulnerable about it because again, there's hardly any social support around, wow, we want a baby and we're not having a baby. What is wrong? What is wrong? What's wrong? And it affects everything from like your emotions about yourself, your relationship, your work life, your career. You're thinking, why did we wait so long? What if I hadn't had that, period of my life where I drank a lot of alcohol? Or like, there's so much self-blame and this really difficult conversations that people are having inside. And then to go and feel like you have to expose all this personal material to someone else, even if it's a trusted healthcare provider. And it's a detailed conversation. So in my clinical practice, which is almost 10 years now, I've never worked with a couple that have come in and fully understood why they're having the fertility challenges they are, or had that fully explained to them, or even literally has it never been assessed properly. Even if they've had multiple rounds of IVF that have failed, most people they've never been told, this is why you need IVF in the first place, unless it's something very specific, like the woman has blocked tubes, which is why IVF was created in the first place, to allow an egg to actually physically meet up with a sperm. But for most other reasons, there's probably multiple minor factors that haven't been looked at that can be restored. And then even if IVF is needed, puts that couple in a much higher chance to have that IVF be successful the first time. We really want to make it count. So I think having this approach of like, I talk about the idea of 5 trimesters. So we're all clear that there's 3 trimesters in pregnancy. Now people are talking about the 4th trimester being postpartum and really honoring a woman and a baby's needs in that space. But there's a prelude, there's a pre-season to pregnancy, and it's preconception. And that has to be at least a trimester, at least a few months of health infused into both partners, which is a traditional practice in Chinese medicine. It's just recognized. You before you get pregnant, you get your cells healthy so that you can pass on the best possible health inheritance to the next generation. This is known in traditional cultures, and now we have the science to establish why it's true. There are 3 months of intensive follicle or egg development that happen before an egg is ovulated or before retrieval in a case of an IVF cycle. And there's 3 months of sperm production from a primordial sperm cell that doesn't even have a tail to the sperm that will be able to fertilize an egg. It takes 3 months for both of those. So that's what I call the preconception season, or the real first trimester 0, some people call it.
Oh, that's really interesting. I've heard of the fourth, but that's a great concept about the initial trimester too. I like that.
Yeah, and there's so much potential in that space, because that's where a lot of the epigenetic programming is going to be laid down for the next generation's genetic expression. And that is so powerful to be able to nourish a woman and a couple in that time frame, like investing love and care and all the protections on that future child's genetic potential before he or she's even conceived. I think that's the ultimate expression of love.
I was actually looking at your website, and you did mention there was one of the blogs mentioned Bruce Lipton, who I absolutely love, and his book on biology of belief and how our beliefs can affect our fertility.
Yes.
So,
yeah, that's amazing. Thank you for reading that. Yeah, I think his work has been very much pioneering in our understanding of how our beliefs create biology. So there's a biological, like a measurable expression of our emotions, our beliefs, our thoughts that show up in how our bodies work, how our hormones express, obviously how we feel. We know that our beliefs will inform how we feel. That's intuitive. But now, of course, we can see in a cellular level and even in a genetic level that certain experiences, whether beneficial or traumatic, will show up in future generations in their genes, in the way that their genes express. So we have a lot of potential to self-program how we're going to feel and how our bodies are going to operate. And, most of your listeners will probably have heard of cases where people have believed that they don't have a tumor, even though they do. And they've been informed that the tumor is gone, or that the tumor is shrinking, or that they've developed a visualization practice or meditation practice that visualizes as it's shrinking in response to treatment or what have you. So, and then they're cured. And then their doctors are like, we don't know what you did, but just keep doing it. Or, right. Or they're like, oh, it's spontaneously remissed, or, right.
Yeah.
Or we must have had the studies wrong or something like that. So, but that is true for our physiology as well. And even when you think about the labels of infertility, or, something is wrong with me, what is wrong? All of these things. Why is this happening to me? This puts us in a physiology of victimhood, actually.
Yes.
And victim role, even if you're not consciously thinking, I'm a victim of this, when you're feeling like something is happening to you, or it's karma, or it's like a punishment for something that happened before, we're forgetting that our bodies renew, and our bodies are miraculous in self-renewal. We're like all bionic women. Yeah. Every cell gets replaced by a new one. And so we want to program the new cells with love and with all the nutrients that they need, and with belief that we are fertile. I have an affirmation that I suggest to clients, and it's, I am fertile in every way. And how hard is it sometimes to actually believe that? But when we start to look for signs of our fruitfulness, of our fertility, of our creator power in other areas of life, we can start to see like, oh, well, if I'm fertile and fruitful in that space, oh gosh, I can be fertile in this body way too, if that makes sense. It's just about training the brain to look for signs of abundance, signs of fertility, signs of that level of blessing and miracle. Because every new life is a miracle. And the fact that your cell can like break down and be replaced by a brand new one with a whole new potential level of health is a miracle.
And it's, it's amazing going back to when women are going through issues trying to get pregnant or the issues. And you're saying that, they go through this workup through traditional doctors, and it's very, very clinical, and they almost feel like a specimen.
Mm-hmm.
How can they regain their empowerment and bring it back to them?
Yeah, I think that's such a great question. I don't know if I'm going to be able to give the whole answer for everyone, but here's what I see. I see that the medical side of it is only one piece.
Yes.
It's sometimes positioned as the whole story, right? And the whole pie is whatever happens in that medical office, and whatever tests are offered as a sort of standard protocol are the ones, and whatever medications and whatever, 3 IUIs, then 3 IVFs or whatever it just is a bit mechanical.
Yes.
And it's reductionist. And so many couples though are only offered that. And it just feels stripped of the whole person experience and the spirituality and the love and the relationship piece and the self-care that people deeply want to go into their conception experience. So but women and men have the power and the choice to incorporate all of what they want into their fertility journey, even if it is going to be with IVF that they will conceive. That's okay, but let's expand our understanding. I talk about a nest, and so like sperm and egg need to get together, but we need to build a nest around that is nurturing and that is whole and that is safe. So keeping your nervous system in a place of safety and abundance and not scarcity and alarm.
Sure.
And how do we talk to our own genetic potential about, how to have that health piece shine so that we feel good through the fertility journey. Again, no matter if it's going to be a medical conception, that's totally okay. You still need your health on board, physically, mentally, emotionally, spiritually. And that medical conversation is not the whole story. It's just not. If it were, it would just work every time.
Yes.
So what pieces of that puzzle can we fill in with people so that they are taking that whole health into their journey?
And you were talking a little bit before about the levels of stress that we experience now.
Mm-hmm.
And, stress affects our cortisol levels.
Mm-hmm.
And how does that affect fertility?
Well, we know that it does. I'm not sure that we knew all of the ways that it does, but it is complex. But one thing that I often share with people that is easy to understand, that is a known phenomenon, is that stress hormone cortisol and pregnancy hormone progesterone are derived from the same mother molecule.
Yes.
Pregnenolone. Ultimately cholesterol, actually, but from the hormone side, pregnenolone is the mother hormone, mother of the other hormones. So if your body is under stress or your mind is under stress, your nervous system and your hormone system need to make sure you survive. The nervous system does not care for you to get pregnant when you're under stress. That is a dangerous thing to do because it makes you more vulnerable to whatever sort of animal is stalking you, or whatever disease is affecting your tribe, or, you're going into winter, or you're nomadic, or there's war. This is our survival genes turning on, except that right now in modern life, thankfully, we're not typically under life-threatening scenarios, although some people certainly are. But when we're talking about fertility-related stress, it's often lifestyle stress. It is like we're busy, we have bosses that are, hard to work with, or we have relationship conflicts, or bullying, or past traumas, or mama drama, or deadlines. We have financial strain. We might have other children to take care of, or ill parents. Like, there's so many things that are on our plates, especially as females. And
Yes.
we're supposed to be doing it all and taking care of everybody else and pouring into everybody else. And there's this almost like spiritual myth that it is something spiritual to do, to like pour yourself out and be in servitude and take care of everyone else. And women naturally do that. And we forget to nurture ourselves.
Yes.
And we forget to have a full pot of fresh tea before we're pouring a tea party for other people and guests. So there's this depletion that happens, especially for females. And in the face of stress, again, your body is if we're in cortisol mode, your body wants to make sure you survive. It's going to keep making that cortisol so that you can keep going, so that you have stamina, so that your immune system is a little bit suppressed and you don't get all inflamed. And then when you're in full safety, again, those fertile hormones will come back on board. But we can't be in both of those states at the same time. So we're either in fight or flight, or we're in rest, digest, procreate. And if your body needs you to survive, it's going to take that pregnenolone as a building block, make more cortisol, keep you going, keep you running and fighting for your life, and sacrificing progesterone. So that can show up in a luteal phase defect, or low progesterone, or just not quite enough progesterone to maintain that early pregnancy implantation environment. And that is just one way. That is just one way that stress can directly impact fertility.
And what about sleep? Because now we're talking too, if we're hitting deadlines and we're trying to take care of everyone else before ourselves, our sleep gets affected too.
Sure. Yeah. I mean, one night of poor sleep can raise your cortisol level for the next 24 hours. Getting good sleep is a sign to the physiology that we are safe, that we have that nightly circadian rhythm restoration. And the melatonin that's associated with good sleep is also a hormone. I call it the conductor of the symphony. It really sets the hormone balance. Melatonin also benefits follicle quality and egg quality, as well as breast health, and it's an antioxidant. Like, there's so many benefits for sleep. So that's one conversation that's hard to have sometimes, because people there has been a cultural push to squeeze down your sleep and do more stuff.
Yeah.
But we're shifting that back to having the competition, if there's going to be any, on how much sleep did you get and how good did you dream, and how many hours did you get of actually good sleep. And that's part of maintaining this miraculous life force that we are all designed to have, is to have that sleep. There's a reason why we all need it, and why we're literally spending a third of our lives asleep. We just need it. And sleep deprivation has been found to affect women's fertility and men's fertility. It affects sperm quality negatively, and it affects for female fertility rates, especially shift work, as a big sign of sleep disruption. Mm-hmm.
And you have a book that's coming out pretty soon. You want to tell us about that?
Sure. The book is IVF Meal Plan, and it walks us through those 3 months of preconception, especially regarding egg quality. And it's geared toward women who are going for IVF and who want to enhance their egg quality through food. And this, I hope, will be a very empowering book for people, because food is something we need to eat. So we might as well eat according to what the research shows does benefit fertility rates, especially IVF outcomes, which is where a lot of the studies are. They happen to be on IVF, probably because there's so much invested in IVF. There's so much riding on it from a cost and sort of medical interventions perspective. So that's where a lot of the studies are, is like, what were people eating before their IVF, and how did that play out into their success rates. And then we talk a little bit about some supplements, and I encourage people to have their partners on board, because preconception counts for male fertility as well. And then there's a 28-day meal plan and recipes created by my dear friend Charleston Delano that fit with the criteria that the research is showing is important for fertility. And they're delicious and they're easy to prepare, and it's going to be fun, and it's full color. So I hope that it's like a beautiful, enjoyable thing to add to the cookbooks collection, and of course to the journey toward your ultimate goal of getting pregnant and having a healthy child.
So how does diet affect fertility?
Well, we know that nutrients directly impact egg quality and sperm quality too. So we need nutrients such as iron and protein and oils, omega-3 oils, to maintain good quality eggs. And in the 3 months prior to egg retrieval and IVF or ovulation in a natural cycle, the ovaries invest extra nutrients into the eggs that are coming up for graduation, for ovulation. Yeah. And like, one of them is going to be the valedictorian and get ovulated out of a class, out of a little cohort, and the others won't make it, but that's okay. That's just nature. And so with that one egg, if we're starting 3 months before it's ready, we want to make sure that all the nutrients are present in abundance, so that they can be invested in those eggs. So eggs even increase their intake of iron in the 3 months prior to ovulating. We need vitamin A, we need protein, we need an anti-inflammatory oils. And so diet can easily provide that if we're eating whole foods. We talk about the Mediterranean diet as a pattern that's been shown in evidence to contribute to healthier fertility in both men and women. And then the diet can also provide shielding from toxins and stress-induced damage to cells and genetic and genes, DNA, because the antioxidants and the anti-inflammatory compounds in a fertility diet can shield the cells and the tissues from the damage of, like pollution and being stressed, because our cells actually produce their own levels of toxins naturally, but we want to get them swept out and get the most important tissues, which in this case for the readers will be their reproductive systems and their eggs and sperm, protected from that potential damage, so that they're as healthy as possible at the moment of fertilization, creating that child's health blueprint in that moment.
If you had to list some foods that are probably really bad to be eating, what kind of things would you say would be included?
We know this from the Nurses' Health Study, that for female fertility, foods like refined sugars and carbohydrates, like pastries, donuts, white bread, white flour, any kind of the tradition, like the things that most people know is not good for us.
Yeah.
Have a negative impact on especially ovulatory fertility, so egg development and follicle health. So do trans fats. So those are shortenings, and fryer oils often will contain trans fat. My university nutrition professor called them potently dangerous molecules, and that was like 20 years ago. So it's been known for a very long time. These are largely synthetic fats that are taken from vegetable oils like corn oil and soya oil, and they're turned into shortening in solid form, and they're white, and they're used in like baking and cookies and pastries and pie dough and things like that. So believe it or not, lard, if you're going to have a pastry, lard would be a better choice, or butter or coconut oil, than hydrogenated vegetable oil or shortening, because those create a lot of inflammation in the body. And we know they're terrible for cardiovascular health, but we also know that they seem to impact negatively women's fertility. And well, of course, most people know alcohol could damage fertility, and then there have been a few studies around caffeine, specifically being contraindicated or not good for IVF, maybe because it can slow down the ability of the endometrial lining to be as plush and nutritive as it could be, because it kind of constricts blood vessels. That's why it's kind of good for headaches and can raise blood pressure. But that might be one to consider, even though most studies where women are taking like 1 cup of coffee or less a day, for natural conception, it might not, we don't know that it impacts it negatively. But for IVF, it seems like something that people should not be taking.
I would think if you're trying to get pregnant, I think you would try to do everything possible. And though it may be tough to skip that morning coffee, I think that it may be worth it just to be safe.
Yeah. And then it goes back to, how can we replace some of your sleep so that hopefully you need that coffee less?
Yes.
Because you're just that much more rested, and less alarm in the body is where we're going generally as well. Yeah.
And I realize it's the diet. There's so many different ways to contribute to a healthy diet, but if you had to give a couple like key foods that people should be, or types of foods that they should be getting in their diet to help with their fertility, what would you recommend?
Omega-3s more than omega-6s or trans, for sure. Okay. So omega-3s are from nuts, seeds, fish, seafood, or fish oil supplements. Protein is important. So wherever you get your sources of protein, make it a clean protein. So the healthiest possible animals, or free range or organic animal protein, or even organ meats. I do encourage you to have, a little bit of liver, or start to experiment with some of those foods, which is not that common anymore in our North American diet, but extremely nutritive, and beneficial probably for fertility for several reasons. And lots of vegetables, because we need those micronutrients, the natural sources of folate, the natural antioxidants that protect our bodies from damage. It's kind of like we want the building blocks of a strong fertility and a strong baby to be in the mother's body, especially before conception, to be available, because especially in first trimester, a lot of women struggle with nausea and not being able to eat the way that they would like to, because they can only take in crackers and stuff like that, because of they're feeling so unwell. So we want to pre-invest a high level of nutrition in the mother's body before conception. And then, I think olive oil has been shown to, because it's a predominant part of the Mediterranean diet, it's a good oil to substitute for the omega-6 oils with like cooking or for eating raw, versus vegetable oil like soya oil and corn oil that are highly processed and probably very inflammatory to the body. And that's an easy substitute, and it's delicious.
You know what I've always wondered too is, I remember when I was pregnant and when I did my training in OB, and it was all about taking prenatal vitamins, and it was like folic acid. And then through my kind of just journey through medicine, I found out that not all people can process folic acid, and that it's really the broken down methyl tetrahydrofolate.
Yes.
So how do women, because they're still out there, you can find them in pharmacies, it's like prenatal vitamins, and they think they're doing something good for their bodies. So how do they make sure they're getting the right type of folate in their systems?
That's such a good question. I think that we're going to see this paradigm transform in maybe 5 or 10 years, because recent research has found that women and babies, newborns, have high levels of folic acid in their blood if the mother's been taking prenatal, like conventional prenatal vitamins or folic acid supplements, as all women are told to do.
Yes.
We also, at least in Canada, I believe in the United States and many other countries too, infuse folic acid into flour.
Oh,
So
wow.
bread and pastas will typically by regulation be enriched with folic acid, because it was found that folic acid deficiency was a risk factor for sure for spinal cord defects. But now we're having probably too much folic acid because we're taking it through flour products if people eat bread and pasta and cereals, and through supplements. And a lot of women, especially those over 35, are having 5,000 micrograms thrown at them or prescribed to them, as if it's this thing that compensates for a woman's age, and that is not evidence-based. So globally, national authorities agree that 400 to 800 micrograms is enough, and 1,000 micrograms folic acid is a max. In fact, over 1,000 micrograms a day of folic acid is a prescription only in Canada dosage. So we don't know yet the significance of these high levels of circulating folic acid in blood, but we do know that that's not natural, that eating folate from food would never cause that folic acid level to be so high. Some doctors are questioning whether the epidemic of tongue ties, or oral ties, might have to do with this folic acid supplementation. In that folic acid, on one hand, or folates, prevent those, they help with the laying down of that midline tissue. So they make that spinal cord whole and healthy. And at the same time, could be laying down too much kind of tissue, if we can think of it that way, in the midline. So this is a theoretical place. It doesn't make sense, though, that like 50% of babies have some kind of oral tie, because it affects breastfeeding and thrush and digestion and hurts their mothers. And it just wouldn't make sense that nature would produce this high rate of oral ties in infants, because it's a risk factor for everyone's well-being.
Yeah.
So folate is the form that I recommend, because 40 to 60% of the population, as you mentioned, does not efficiently change folic acid into folate, and folate is the form of this nutrient that the body actually needs. We also need adequate levels of other nutrients like vitamin B12, choline, betaine. These are like forgotten preconception essential nutrients, to take that molecule through and make sure that we don't build up another molecule that is dangerous called homocysteine. And homocysteine levels are a risk factor for inflammation. They're a risk factor for cardiovascular disease, but also an independent risk factor for miscarriage.
Okay.
So we need folate and other methyl donors to take that homocysteine, change it into an amino acid, methionine, and make sure that it doesn't build up. And we need to provide folate so that we don't jam up that whole system and like build up. We know that folic acid is building up in people's blood, but is it a result of folic acid supplementation alone? I'm not sure. There's a genetic component, but again, the ability to use folic acid efficiently is suppressed naturally and genetically in like about half of people. So the easiest way to get around this, aside from genetic testing, is just take folate, which provides for that folic acid, because your body will naturally make it from folate. But it's really about the folate. Whereas if you take folic acid supplements, it's like you have to go backwards in that physiologic cycle, and then you're risking, again, that buildup of homocysteine, because you have to share these little molecules between them, the methyl groups. the carbon and 3 hydrogens, as I'm sure you're aware. And it sounds weirdly simple, but that's what it's all about. It's like, we're getting into our biochemistry here,
but it's amazing because I mean, that's what's been pushed for so many years.
Yes.
Even in, the traditional medicine, I remember being trained like, okay, everybody's got to be on folic acid, get anyone preconception, conception, beginning of pregnancy, get them on folic acid. And then it was like, no, maybe not.
Yeah. Maybe folate. And men need folate too, because it's important in like the genetic, it's important in DNA production in both eggs and sperm. Okay. So there's a reason for men to be on a good preconception or prenatal as well before they conceive, with a good multi as well, with active folate. So like you mentioned, it's the L-methyl tetrahydrofolate would be what people would see on the label of a good quality prenatal or preconception supplement, rather than folic acid, which is the synthetic form found in most supplements. Like probably over 90% of the supplements are folic acid today, and it's certainly what drug companies produce and what most physicians recommend. But you're right, it is probably a little bit skewed off of what the body actually needs.
Is there a way to do it with foods?
Yeah, the folate found in foods is the natural form of folate. So there's legumes, there's certain animal proteins, there's green leafy vegetables. Those all contain folate. And the fertility diet contains high levels of these foods in exchange for like refined grains and other types of food. So it is a folate rich diet anyway that we talk about in the book. And you can also test your folate level. You can test your red blood cell folate level to see how is there enough inside your cell. So the red blood cell is one easy marker to see if it's rich enough in folate. We assume that all the rest of your cells, including eggs or sperm, have enough folate in them. And that could be a good marker to give people peace of mind if they're concerned about it. Meanwhile, I still do recommend a supplement for women and men who are trying to conceive, but keeping it 400 to 800 micrograms of folate is enough.
Yes.
All authorities internationally agree. If they put out a position paper on it, it's 800 micrograms. There's no research to go more than that.
I think it's tough because I think a lot of people go, well, if a little bit's good, then more is going to be better. And I think that's kind of unfortunately becomes the trend. Well, I'll just take extra and that'll be even better. Yeah. And it's a false sense of, well, I'm over 35, so I better have more folic acid. It's just a false sense of, it doesn't add anything to the scenario. It's like we're filled up now. There's more than enough, but we don't also know the effects of having too much on both generations. And that's, when I was doing obstetrics in my training, that's how it was done. If someone was under 35 years old, we would give them 400 milligrams. If they were over 35, it was like, all right, we'll give them a full gram.
Yeah.
So.
Yeah. And now it's 5. Wow. A lot of women are being prescribed 5. 5 milligrams, 5,000 micrograms.
That's a lot.
And it's just, it's too much. And because so many people simply genetically cannot deal with that molecule in that dose, we just have to follow what the evidence says.
So this is great. And I'm so excited about your book coming out. Where can people find the book?
Wherever books are sold. Right now, as we speak, it's an Amazon pre-order, and December 3rd, it will be released in print.
And if somebody's having difficulties, and say if they don't live in your area, can they still get your services?
Yes, I work with people across my province, Ontario, by telemedicine. And I also have a digital course that has to do with fertility lifestyle and self-care. So people can contact me through my website if they're curious about that.
And what is your website?
It's tworivershealth.ca. So TWO rivershealth.ca, or you can just Google my name. And then in my calendar, you can book a conception confidence call to see what resources are a good fit for you.
That's great. Thank you so much for being with me today.
Thank you so much, Dr. Betsy. This was a pleasure.
And I'm looking forward to your book and all the good work that you're doing.
Thank you.